Hello everyone, Suparna. Welcome back to my channel Suparna Speech Therapy Clinic. Today's topic is the management of ASD. Like who are the professionals included or involved in the management of ASD. In my last video, I had discussed about the I have emphasized on the early intervention, early diagnosis, early intervention, and the role of a multidisciplinary professional and role of multidisciplinary professionals. So today I'm going to discuss on the management of ASD. So basically the core features or the triad features that the ASD children exhibit are the lack of communication skills and the social interaction, lack of social interaction, and stereotypic behaviors or repetitive behaviors. So these are the triad features or the core features exhibited by children with ASD. So in this we need to address the communication skills, we need to address the social skills, along with that we need to address the behavioral skills. So as I mentioned earlier, ASD children also exhibit, apart from these behaviors or these deficits, they exhibit some kind of sensory issues. You know, there are many sensory inputs like touch, vision, auditory, like smell. There are many senses. So these children might have hypersensitivity or hyposensitivity. That is, they may be either highly sensitive to a certain stimuli or very less sensitive to a certain stimuli. It can be like a touch, like a smell, sound, like an auditory stimulus. It can be also a visual stimulus. It can be in either of the way. Like in any of these, they can exhibit some kind of issues. Like it can be hypersensitivity issues or hyposensitivity issues. So OT or an occupational therapist is a professional who is basically involved in the management of sensory issues, or the person or the professional who deals with the sensory issues. So as I said, we need to have seek a medical help or a professional help from a ENT, pediatrician, neurologist, apart from the other professionals. So the main role comes to SLP, speech language pathologist, who addresses the receptive and the expressive language skills, and also who has to manage with these communication skills, and occupational therapist who addresses the fine motor skills, the gross motor skills, the activities of daily living, and also the sensory issues are addressed and also dealt or managed by an occupational therapist, and a psychologist who deals with the emotional skills, the behavioral skills, the cognitive skills, and the social skills in a child. So basically we need to have an integrated approach from these professionals. So as I said earlier, once the ASD is diagnosed, early diagnosis, after the early diagnosis, next is the early intervention or the early management, which involves these three important professionals, and that too will be very effective and beneficial to the child if it's given under a single roof or from a particular center. Like if the child is attending speech language therapy in one center and child is attending occupational therapy in another center, and psychology, he visits a psychologist in another center, like a child will be getting benefits out of it, to a certain extent. But it is always effective and it is always advisable to the child to have a multidisciplinary approach and an integrated approach with this. If these professionals collaborate, or if they are working under a single roof, or they can have a discussion among themselves regarding the positives or regarding the strengths, weakness, potentials, and they can also discuss regarding the goals set up for the particular child. So they can have an integrated and a collaborated approach for the particular child. So it is always better to have a multidisciplinary approach or the multidisciplinary team under a single roof, where the child can seek help from these professionals at the same time. So it can be they can have individual sessions, or they can benefit even from group sessions also. So it is because they have like the ASD children, they have deficits in social skills, social interaction, they have social interaction problems. So they can benefit from group therapy also. So it is always advisable to have an integrated approach which can be done at a very early stage as soon as the ASD spectrum is autism spectrum is diagnosed, and that too under a single roof. As I emphasized in the last video, I am emphasizing again here on the early early identification, early intervention and the multidisciplinary approach in the treatment and assessment of ASD. If you have any doubts or you want to know regarding anything in detail, you can mention in the comment box. Any discussion can be done either in my Facebook page, Suparna Speech Therapy Clinic, or you can mail me. I'll be providing my mail ID at the bottom. So please like, share and subscribe my channel, Suparna Speech Therapy Clinic. Thank you.